Hello, this is Dr. Gay from First Look MRI, and this is a 54-year-old male who fell recently and has a history of a shoulder dislocation, and he has a few interesting findings. Number one, this is an axial view. We see a round ball here, the humeral head. We see the glenoid here that it rotates in. This is the cup the humeral head rotates in, and we see a little dark band here. If we follow this up to the top, this is where it originates from the glenoid, the anterior glenoid rim, and this is the biceps long head in abnormal position. Normally this will sit over here in this little cup called the bicipital groove. So this is a dislocated biceps tendon. If we look on this view over here, we see the biceps tendon coming off here. This is the glenoid, the anterior superior margin, and we see this coming down here along the anterior joint. Down here, normally this will go over the top of the humeral head like this, and then it'll go down through the bicipital groove like this. So dislocated biceps tendon. And we see a dislocation, we know that the subscapularis tendon has to be torn. This is the subscapularis in front. We have the rotator cuff muscle here in back coming over. We have this subscapularis in front. We see the central tendon coming over here. It should attach to the lesser tuberosity, but since the biceps tendon is dislocated, we know that that is torn from the attachment, and the biceps is allowed to slip medially. So a torn subscapularis tendon from the insertion with biceps tendon dislocation. We also see lots of edema back here along the back, lower rotator cuff muscle. This is the teres minor muscle. So a muscle strain back here. Also deltoid muscle back here has a strain. And we also see here in the front a little bit of brightness in the bone. This is the greater tuberosity of the humerus. This is where the supraspinatus attaches. There's a little bone bruise there, really subtle bone bruise. If we look on this view, we see the supraspinatus coming over, attaching, is not torn, but there's a little bone bruise we saw over here, and this is related to the dislocation. The biceps when the biceps dislocated, the subscapularis tendon was torn and the humeral head was shoved downward, and when it got shoved downward, the humeral head here impacted the bottom of the glenoid. So it went all the way down here and then came all the way back up. And when it did that, it tore a structure down here. This is the inferior joint capsule. So we'll see it better on this view. Here we go. So again, the humeral head dislocated, and this part went all the way down here and impacted the inferior glenoid, came back, and that stretching caused a tear of this. This is the inferior joint capsule. It comes off the glenoid here, comes down, and it should attach over here in the humerus, but instead it is stripped, torn off the humerus and down here. So pulled off, and we call this a HAGL, humeral avulsion of the inferior glenohumeral ligament. So it avulsed from the glenoid, so the joint capsule and the inferior glenohumeral ligaments just are a broad band. They kind of blend together. There's a little bit of thickening of the anterior joint capsule and thickening of the posterior joint capsule. We call that the anterior and posterior bands of the inferior glenohumeral ligament, and again they're torn and pulled off, and this goes along with the humerus going way down here, ripping off the ligaments and then coming back up to normal position. So a bad injury, and just a recap here: inferior dislocation with associated torn inferior joint capsule and inferior glenohumeral ligaments, torn subscapularis tendon from the insertion with associated dislocated biceps long head, and there's also fluid here in the joint. We're going to look for one more thing here in the front. We're going to see the middle glenohumeral ligament. It comes off here next to the biceps long head, and it kind of looks like the biceps, but it's right over here. Usually it's more vertically oriented, but this goes backwards way over here. So instead of going straight down, it goes this direction. That's because the subscapularis tendon is pulled backwards and the whole joint capsule is pulled backwards. So this attaches to the thickening of the joint capsule here. So the MGHL, or middle glenohumeral ligament, is intact. It just is pulled backwards a little bit. And that's it. Thank you very much.